Hello, my name is Ashwin Sridhar. I'm a consultant urologist. And as a urologist, I specialize in conditions of the kidney, bladder, and prostate. I'm recording a series of videos to provide some information regarding common conditions that you might come across when you are looking for a urology specialist. Please feel free to go to the videos and come and see me if you would like to discuss any of these further.
How can I have blood in my urine without it being painful?
So blood in the urine can be associated with pain or it can be painless. Association with pain usually tells us what could be causing your underlying symptoms. The conditions that usually are associated with pain and blood in the urine include infections and stones. If you have painless blood in the urine, we want to further exclude things such as cancer within the urological tract. Whenever you see blood in the urine, with or without pain, it is very essential that you seek out an expert to look into this further. You can either see your GP and then come to see me, or if you choose, you can come to see me directly. We can have a chat and investigate this further.
Is blood in the urine caused by the same things in men as in women?
Hematuria is the term given for seeing blood in the urine. There are a lot of causes that are common between men and women, such as infections, stones, or cancer. Certain conditions that can be unique to men and women. Conditions that are unique to men are things like prostate cancer or an enlarged prostate that can sometimes cause blood in the urine. Conditions that are unique to women include blood that can be seen during menstruation that could be confused for blood in the urine, or certain conditions of the gynecological tract or the anatomy within women that could be causing blood from the bladder or the water pipe. All of these conditions need evaluation, and then you can see us to see for further evaluation with an examination or further tests.
How can there be blood in my urine but I can't see anything?
That's a very good question. Blood in the urine can be there even without you seeing it. And certainly sometimes we pick it up only on testing your urine sample when you go to your doctor or when you come and see an expert such as myself. Now, blood found on testing can mean a lot of things. There is a lot of blood that goes through the kidneys to make urine, and sometimes red blood cells or cells that are there within the bloodstream can make its way into the urine. Now, certainly when you have associated tummy pain and blood in the urine, it suggests that you may be unwell, and that might be a body response where we're finding blood on testing. Certainly, this does need evaluation if it persists, and seeking out expert advice, such as seeing a urologist, might lead to further tests and give you a better answer.
I had blood in my urine but no cause was found. Has something been missed?
It's quite common not to find a cause for the blood in the urine. It doesn't mean that something has been missed. Certainly 80% of the times when we investigate blood in the urine, we don't find a cause. It doesn't mean that you should ignore it. You should certainly get it looked into, and we will suggest a monitoring program where we might say, if you do find it again, we might need to look into this further.
I'm terrified because I'm passing clots of blood in my urine.
Clots of blood can be quite terrifying, and they suggest that the blood has been sitting within the bladder or the water pipe for a certain amount of time to form clots before it is coming out in the urine. This suggests that there is quite a bit of blood that is coming out in the urine, or could potentially be blockage within the bladder that is not allowing it to come out in the urine freely. Causes for clots and blood in the urine could range from infections, stones, or cancer, and it is essential to have these looked into to further evaluate it to see what is causing this symptom.
What tests do I need if I have blood in the urine?
So blood in the urine can be quite a worrying symptom, and that is sometimes what makes you go to see a doctor and a specialist like myself. When you come and see us for further evaluation, we will start off by asking you a few questions just to try and understand when you saw this blood and what might be causing this blood in the urine. We will perform an examination, and then we will go on to test the urine sample for an infection. We might ask you to do some blood tests to look at the blood cell levels in the blood, as well as how the kidney is functioning. Once we have done all of this, we may consider further tests, which are scans, and these could range from either an ultrasound scan or a CT scan to get a more detailed information about the urological tract. We may also suggest for you to have a camera test, or which is called a cystoscopy, to look further into the bladder and the lining of the water pipe. This will give us all the information we need to find out if there are any sinister causes for the blood in the urine.
How do you treat blood in the urine?
The treatments for blood in the urine depending on the underlying cause. A lot of the time, we are unable to find a cause for blood in the urine, and we may suggest conservative measures such as drinking plenty of water, maintaining a healthy diet, and resuming your usual activity, which could flush out blood from anywhere within the kidneys, the bladder, or the water pipe. On further examination and investigation, if we find causes such as infections, we might choose to treat that with antibiotics that will work against the bugs that we find in infection. If we find stones, we may have to treat it depending on how big it is and where it is. And if we find cancer, we may talk to you about further tests and procedures that might be necessary for further diagnosis, and that will tell us how we need to treat this. Nonetheless, this is a condition that should not be ignored, and it should prompt you to see your doctor or see us directly for further evaluation and treatment.